I'm Helene Fronick. Welcome to Doc Talk, San Diego County Medical Society's webinars on enhancing communication in the healthcare setting. In our last segment, we covered the communication skill of signposting, a skill that takes about 30 seconds and pays huge dividends by providing structure and allaying our patients' anxiety. Today, I thought we'd switch gears and talk about a different communication skill that's been shown to improve clinical outcomes, improve our practice success, and lower our risk of malpractice. If that sounds like a great skill to use in your practice, it's because it is. In each of our areas of specialty practice, we see patients, a lot of patients, with the same diagnosis. Here's a person with hip arthritis. But even though that's an easy diagnosis to make on most plain films, do we really know what the medical problem is that we're treating? For instance, is this a 60-year-old patient who lives to play golf and is really crushed because he's had to give up the game that he loves? Or is this a 60-year-old person who's very content to sit at home reading a book and barely notices that his hip hurts? This is a patient who I might see in my practice, a woman with varicose veins. But again, is this a woman who suffers from a lot of pain so that when she comes home after standing on her legs for a whole 8-hour shift, she has to lie down for a half an hour or an hour before she can even think about going on with her second job, making dinner, helping the kids with homework, doing laundry? Or is this a patient whose main concern is cosmetic? You can see that the effect of the patient's condition on them is going to make a big difference in terms of our treatment planning. More and more, in addition to just the medical condition, the disease process that we used to focus on, we're focusing on the patient's perspective, how they feel about their condition and what effect it's having on their life, because that is really what we need to deal with. As Sir William Osler commented very wisely so many years ago, it's much more important to know what sort of a patient has a disease than what sort of a disease a patient has. So how do we get at this component of care easily, quickly, and effectively? All we have to do is ask one question, and that question is, what about this concerns you the most? And if we'd like to, we can follow it up with, what else concerns you? It's probably clear that knowing the effect of our patient's illness on them is important in planning their treatment. For instance, the active person with hip arthritis is probably going to be much more interested in a hip replacement than the person who barely notices that their hip is hurting. And our lady with painful varicose veins might be extremely pleased if we simply give her a compression stocking to wear. Whereas our patient whose concerns are mostly cosmetic would not be happy with this kind of solution. But did you know that the concern that we show with that question actually makes a difference in how our patients respond to treatment and in their recovery? When patients felt that their doctors dealt with their concerns well, their sore throat symptoms went away more quickly. And it was the doctor's concern that was cited by patients as being a major factor in helping them control their blood pressure and lower their blood sugar. And in yet another study, the duration of headache symptoms correlated best not with the diagnosis, the treatment, or whether the patient was referred to a specialist, but with the patient's perception that they were able to share their concerns with their doctor. I'm sure that many people will be concerned that asking these kinds of questions is going to add a lot of time to the patient visit, and we are all under pressure to see more patients in less time. So I'm sure that you'll be reassured that doctors who added these kinds of questions spent less than 2 extra minutes per patient visit. Now, in order to get to the real problem that we're treating and make ourselves much more effective and have our patients be treated and respond better, that seems like a pretty small amount of time investment. Wouldn't you agree? For those of you who are interested in learning more about these skills, I would recommend the following references, especially the last one, Skills for Communicating with Patients. It's an excellent text chock full of great communication ideas. I'd also like to invite you to subscribe to my communication blog at helenefronickmd.wordpress.com. I'm Helene Fronick. Thanks for joining us for Doc Talk. We hope to see you again next time.